Hey everybody, it's Monday, February 1st, 2016, and it's 3:45 and I'm on my way late, on my way to my appointment with the breast surgeon, Dr. San Augustin. So I not really looking too forward to this appointment because it just makes me kind of sad, but we'll talk more about that later on. But for right now, I just wanted to check in, let you know I'm on my way, and we'll also hear my consultation. I'll record that too. Survivor mode. Hey guys, so I'm here in the doctor's office and I'm just waiting to be seen, and I'll take you in with me when I go. So I'm feeling so-so, but unexpectedly my son and my newest grandchild was here. I ran into them in the hallway, and my dad, he's so loud. He said he's Bermudian. Okay, but that doesn't mean you need to be loud. But anyway, I'm glad I get to see my daddy. So that's wonderful and awesome. Thank you, God. So I'm in the exam room. Oh, let me close that up. I'm showing too much. Waiting for my breast surgeon and for the pre-surgical consultation. And we'll talk to you soon. Just waiting for my breast surgeon to come in. My husband's here with me.
How are you?
Dr. San Augustin. Hello.
Oh, look at that.
How are you? How you doing?
Good. You completed it, huh?
Tomorrow. Tomorrow's my last chemo.
Who's the one who's been treating you?
The one that you referred me to,
Dr.
Barry.
Barry?
You were so right. You're the best
He is very,
doctor.
very nice. Yes, of
He
course.
is beyond like been a friend to me. Not only just a physician, but a friend.
Very
He's just
nice.
like kept me through this whole thing. So
What did he tell you? Neoadjuvant
Well, I looked at the MRI. We've been celebrating.
therapy. Oh, the MRI looks so much better.
I know. Did you see what it said?
Mm-hmm.
When they can't give you measurements, and they
That's
tell
right,
you,
yeah.
that's just God. You just like, I'm like, really? We had a definitive measurement before, and now where they're like, complete resolution of this, complete resolution of that. I'm like, yes. And I wasn't even done with chemo yet.
You have what? One more?
One more tomorrow, and I got that done
Last
in December. The MRI.
Tomorrow.
So I'm on the last Taxol, the weekly Taxol.
What did he give you? AC?
I had the AC.
Adriamycin, right?
I had that for the 4 rounds of that, and then 12 rounds of the Taxol. So tomorrow's gonna be round 12.
That's all. That was 12.
Now he said that he recommends the surgery. I was like, when do you want the surgery done? He said no earlier than 3 weeks and no more than 6 weeks out.
Okay.
Is that
Yeah.
And then I started.
Suggested surgery within 3 to 6 weeks, is that right?
Yeah. So I started getting, all of a sudden, I was doing okay. And then this morning I woke up very sad, thinking about, because it's the next phase and I'm not going to be me.
No, but that could be reconstructed at the next.
I know, I met with Dr. Pio, like you told me.
Yeah.
So I met with him, so he'll be working with you, so I don't know how we coordinate that.
All right. When did you see Dr. Bayer?
So about a month ago. He is wonderful. I knew when I met him that he was a doctor for me.
Seen by Dr. Bayer.
So he's ready. He explained to me my options.
What did you opt for?
He offered both
Which one?
the deep and also the one with just the
Prosthesis?
with yes. And I said I'm not doing 16 hours under anesthesia, especially after what happened to me before.
Oh, yeah. Of course, yeah.
I don't ever want to see that again. I'm already terrified. It's going to be a 6-hour procedure. He said that it depends if I'll have 2 or 3 procedures because it depends on how much you're able to conserve of the fat between this, I guess, the fat layer and the skin. That he'll be able to either put the prosthesis right in right then, or if there's not a lot, he'll have to use an expander. Because now they don't do that like they used to do before. They're able to do it in a to save us that. And I'll still have to come back just to get the nipple done.
Flap or prosthesis? Tissue expander.
And he was saying, I thought that it said like how much fat. I'm like, oh good, I got fat boobs. He's like, no, you won't know until after you do your part.
That's correct.
The quality of the, I guess, how much lives or
Sure.
is preserved.
Right. Okay.
There's no way
Now,
really
now
to
you're
see.
talking about 3 to 6 weeks, 3 weeks from the last treatment, right?
Yeah.
When is the last treatment again? It's tomorrow.
Tomorrow, but I was hoping more than 6 weeks so I can get a breather.
Closer to 6 weeks?
Yeah, I was looking at like the second week of March. I said June.
Question mark, second week of what?
March, that would be like the 6th week, right?
March, let's see, it's only the beginning of February.
Today's the 1st,
Uh,
so 6 weeks will be,
February, March, April, May.
no.
2
Six-
months. 6 weeks.
6 weeks is a month and a half.
No, a month and a half, which will be February, March, middle of March.
Yeah, that's what I said, second week of March.
Second week of March is what you think of?
Yeah, because that would be 6 weeks, it's 42 days. We're in the first day of February. 42 would be 43.
March, okay.
31 days in March.
We'll
Minus 43 is
schedule
11.
With-
It's 12. It's March 12th.
with Dr. Pio.
It's March 12th. Will be exactly 6 weeks. Will be
6 weeks,
today for
okay.
that.
Now, everything's been fine with you so far?
Yeah.
The chemotherapy's been well tolerated?
I actually did really well. The side effects that I had, they didn't last long.
Mm-hmm.
Believe it or not, the Taxol, the lighter chemo, is kicking my butt more than the AC.
Really?
At least the AC, it would be really hard.
Have
for
you
like-
lost a significant amount of weight or not?
Do I look like I did? No.
What happened?
The steroids.
the
The
steroids.
steroids. Oh my gosh.
Are you still on it?
Yes, every time you get treatments.
The what?
Every treatment you get steroids. Oh, sorry, Rick.
Good, yeah, swallow.
Every treatment you get steroids.
Mm.
They pack you up with Decadron.
Any pains at all here?
Well, yeah, I always have the back pain, but I think it's stress.
Is he gonna stop the steroids?
Well, yeah, that's only with the treatments. I'm not on steroids outside of that.
You only get a single boost for every treatment, right?
Yep.
Deep breath. Again. Again. Good. Breathe easy. Put your hands on top of your head. Wow, big difference, huh?
Yeah, at first it was crazy. Like 3 months in, I was like, I can't find the lump.
Mhm. Lay down for me. What is he going to do in the left breast? Is he going to do the left?
Well, remember, you're doing a bilateral.
Oh, you're supposed to.
I want bilateral. I want everything removed. And I'm doing a reduction. I want double D's. I'm going to be looking good. I'm going to do double D's, lose some weight. I'm going to be a perky 90-year-old.
100-year-old. Better.
Yeah.
Let's go for 100.
I was like, yeah, I got enough fat to do the deep, but I'm like, I'm not doing that. I'm like, I'd rather lose the weight.
Just the complications of the other one.
Right.
Horrendous.
Exactly.
And I don't think anybody wants to be really out there at night for hours and hours and hours and then.
Now, I have a real concern about something that I want you to all talk to me about.
Sure.
I'm really concerned about the lymphedema that I've been reading about and how we can prevent that. What's been your experience with bilateral mastectomy? And, because I already
Well, the
have like this-
left arm is very unlikely going to develop lymphedema on the left side, but the right side is what you worry about.
Yeah.
Because of the fact that, have you spoken to a radiation oncologist?
No, I asked Dr. Barry, and he said that that would be after you guys do the surgery. You'll look at this, I guess you still look at the sentinel node anyway, right? During that time.
Right. We'll look
And
at
I
the
guess
central node.
the lymphedema only happens if there's any lymph nodes affected. You do a dissection
Well,
of it.
if we do an axillary node dissection, and and then they have to radiate it, the combination of the radiation and the axillary node dissection,
Increases
it
the
just
chance.
increases your chance of developing that. But what we do now is we're very, very aggressive right after surgery, before you even have signs of any kind of lymphedema. Usually we send you to the lymphedema clinic, and they start giving you massages and all kinds of different exercises and so forth to help prevent this thing from happening.
How how much of a concern is it? Because I already have like, for some reason, I always have like this pain in my muscle going up here. I don't know if that was my lymph nodes, but is that a good sign that the MRI didn't uptake anything in my lymph nodes from the MRI?
Of course, that's a very, very positive thing.
So that when they look, so you're gonna have to take the sentinel node no matter what?
Oh, you have to, yeah. You don't want to leave cancer behind. With all what you went through, you certainly don't want to leave anything.
But that isn't what causes the lymphedema, right? It's the...
It's removing the lymph nodes and then radiating them. The combination usually is, it gives you a higher instance of lymphedema.
But hopefully the sentinel node doesn't show any of the cancer cells in it, and then how much of a chance is it then with lymphedema?
Well, it's hard to give numbers. There's many factors involved in it. Okay, so I'm going to talk to Dr. Pio
Okay.
and see what's up with the date.
Okay.
And then we'll let you know. Did Dr. Pio need to talk to you again about the risk benefits and what to expect and so forth?
He did a pretty good job of explaining everything to us. That's how we decided what type of surgery I wanted.
Right.
And I said we just want to do the implants.
Implants, right.
And but there really isn't any way you can look at to see the quality. How do you know the kind of quality, like what he's talking about, like what you're going to do? What are you going to do when you go in and do the bilateral mastectomy?
Well, what we do is we try to, in your particular case, there's no problem because you have so much tissue there. He will help me just design the incision so that the reconstruction would be very, very nice. That's basically it, and then we will proceed with the surgery. Hopefully, we'll be able to match the two breasts very, very well. Did he talk to you about what size prosthesis he's going to put there?
I told him I want double D's, but he said that it's always got to be what's going to be the best for the patient.
That's right.
So I do know that he's going to make that decision.
Sure.
I wake up with what he's going to do that's best for me.
You, right?
And that's okay. My other thing is,
you have let's see, March 6 weeks.
I want to start losing some weight.
Yeah, you really.
I know because it increases, especially anesthesia. A higher BMI is more of a risk.
Much higher risk.
I know.
And also the BMI is a big issue in terms of cancer recurrence.
Mm-hmm.
After you menopause, the body continues to produce estrogen through the body fat. Those patients with very high BMI of over 30, 35, and that you certainly are up there, most of this body fat is converted in your liver into estrogen, and it feeds whatever tissues are in there.
Okay.
And you don't want the cancer to recur. And then, of course, if you're going to have a bilateral...
You want to be nice and symmetrical.
Symmetrical.
As well.
Not only that, you also want to look good, all right? And, it's you want a nice new outfit there, and you nice brand new breasts there to match the rest of your body, and your hair's going to grow back.
And you don't want to have all the rest of this on here.
Yeah.
And I wanted to do, well, one of the things is that during chemo, my plan was, I'm going to lose the weight while I was in chemo. Then it had to do with the energy level, and then Dr. Barry, because I had issues with my immune system, he didn't want me going out with other people because I struggled with catching things, and he wanted me to alleviate that. But now that
the weight gain from steroids is very easy to lose because that's all fluid.
Mm-hmm.
But
not only that, it's eating. You get so hungry,
well,
Dr. San Augustin. Oh my gosh, you want to eat everything.
Right. Well, you want to look good, you want to live long, and both of those things you really
That's
have
the
to
next
make
step
up
for
your
me.
mind.
That's what I plan on doing.
Very, very, very. And you don't have that much time because what happens is if you have this much weight, and then Dr. Pio does a good reconstruction, and then you lose to 30, 40, 50 pounds after the surgery, everything's going to just sag, and it's just not going to look good. All right, so you really should try and get to that weight as ideal as you could to the quickest time possible.
Okay.
So starting tomorrow, just make a firm determination, be active, exercise, and absolutely at least half portion of whatever you normally eat. Avoid whites, white bread, the rice pastas and all that. Eating is a habit. All right. Once you get into that groove, it's going to be very, very easy for you to follow.
Well, for me, what's been happening, it's not so much of what I consume, it's about me being active. I'm inactive because I'm always lying down and I'm tired from the chemo, but now I can start being active and swim and do things like that.
Right.
So my other question is the nipple. We're definitely going to get rid of the nipple because of the piece that was inside the nipple, so it has to go?
The cancer that you had was quite diffuse. I think preserving the nipple and the areola might leave some cancer cells behind. And besides, you know, Dr. Pio will do a remarkable job of reconstructing that on his own. So we're not going to worry about that now because I'm sure he'll do a good job.
Awesome. And how long will your part of the surgery take about?
About an hour and a half.
That's it?
Per breast.
Oh.
It's 2 to 3. But while I'm going on the other side, he can start reconstructing the left side. The reconstruction, if he uses the prosthesis, is very, very quick. All he has to do is lift up the muscle and then put the prosthesis underneath it and just put a graft, which is a sling, where the prosthesis sits.
How much pain am I going to be in?
Well, it depends. If you really want larger breasts, the pain is usually from stretching of the skin. You know, if you have this much skin and you want that much breast, then the stretching will cause moderate amount of pain. But it's not something you should be afraid of because the medications will take care of that.
And I'm going to have drains that are there
Well,
too?
the drain will definitely have that.
Okay. All right.
God bless you. You went through the worst of it.
Thank you so much.
No, you've been awesome. And what are my next steps with you? What do I need to do? Just wait for you to coordinate the date of the
Yes,
surgery?
I have to call Dr. Pio, find out what his schedule is like. And then Katie is my scheduling secretary. She'll call you back. She'll tell you exactly.
Okay.
This is really more staff, correct?
Yes.
Okay.
Thank you so much.
Good to
Thank
see
you.
you.
Good to see
Bye.
you too.
Bye.
Breast surgeon, and I'm going to look for a date sometime. They're going to give me a date sometime like the second week of March. He's going to coordinate with the reconstructive surgeon and give me my date. And you heard what he said about I got to lose the weight. So since I don't like giving up the white stuff like rice and bread, I definitely need to exercise. So tonight, while I have some energy, I'm going to do some form of exercise. Tomorrow is my last chemo. I get a little bit tired after that, so if I just lift weights in my bed tomorrow, something. And we're going to start back at the Y. So the Y might be more towards the end of the week or the beginning of next week. My energy comes out, but that's it. No excuses. Let's try to lose as much, close to 20 pounds as possible. Survivor mode.